Last thing you're going to be able to focus on with ultrasound that we miss with MRI, we miss with other modalities, we can actually see the tendon move. So sometimes you have what appears to be a complete tear of a tendon, like the supraspinatus tendon, but when we move, the central tendon of the muscle is still working. So that conjoint tendon is still attached, so they don't have a complete tear. So we're now looking at the function of the tendon, and we're able to see things that are maybe not seen. And do you have to get surgery for that? If there's still a partial attachment and it's a healthy attachment, maybe not. The other thing that I want to think about with this with rotator cuff is what we're finding over and over again. Now that we're doing all this advanced diagnosis, so we're doing a diagnosis where we can see it, we can see what comes apart, we can see how things move. We can also do a test with a small amount of lidocaine or ropivacaine, or we can hydrodissect the nerve to define exactly where the problem is coming from. And what we're finding is that sometimes you get a complete rotator cuff tear, and you know what, you don't need to treat it. If the shoulder is still stable, as long as the shoulder is stable, the deltoid can take over, and somebody has a completely normal functioning life. Why do you want to go through that surgery that can fail when you're functioning very, very well without the surgery? So we're able to kind of delineate who needs to go to that surgery and who doesn't. Once we see the shoulder being unstable in multiple ways, and there's a rotator cuff tear, then we start to think, well, this may be the case where we want to make sure that rotator cuff is corrected. So we can make a little bit more delineation of who needs to go the surgical direction versus who doesn't. And whenever I say that, I always say that the surgeon is the ultimate decision maker of what he sees as being successful. With what we see with regenerative solutions, we kind of see what we can get to be better. And surgeons kind of see what success they have to get somebody better. So everybody's trying to be honest and coming to a good conclusion for how to get you through your problem. So I hope this explains why the use of ultrasound and regenerative procedures, as along with hydrodissection, makes a difference for you. Now, the last thing I'm going to talk about with the shoulder is if you get one of these procedures, when and how do you get better? So you get a hydrodissection, that may feel better in a few days to a week. And that may just last for a long time, or the nerve may be irritated and needs to be done again. But the regenerative solution, we're actually trying to get something to heal that's been torn. We don't really expect to see a big change in those mechanics, in your ability to move before like 10 to 12 weeks. So you have a 10 to 12 week healing time. So if you expect to feel better from that tear ahead of time, then the only way that you should feel better is because we taped you and gave you and supported you and showed you how to move and rehab better. But the structure is not actually going to get better for 10 to 12 weeks. And it's going to keep getting better for another 3 months after that. So we just want to be aware of where is your expectation. Okay, I got this much better from the hydrodissection. That's awesome. I feel better. And then I know I have to get through that 10 to 12 weeks to get this resolution of instability, resolution of the pain associated to the structural injury. And I need to be careful how I move. So that's just your expectation. So when you come in, just a brief, we can see a little bit more with ultrasound. As far as stability, we can diagnose a little bit better with ultrasound. And I see that better, not in and of itself, but we combine all the imaging modalities that are required. If we add ultrasound to it, we're better off. And once we have this good diagnosis, then we can direct you to, do you need a hydrodissection to treat the nerve? And you're going to have that resolution in a few weeks. Or do we need to get something to heal, and that's going to be resolved in a few months? Or do you need to go to surgery, and that's going to be resolved as the surgeon says it's going to be resolved? And that's kind of our go-to for the shoulder.